Good afternoon, everyone, and welcome to part two of our CCHP CalAIM educational series. We're really excited to go ahead and have you all today, as well as our speakers that are going to go over foundations of care, which is going to cover the topics of supporting kids with behavioral, developmental, and early childhood needs. Today, we're going to have representatives from our CCHP Behavioral Health Department, as well as HMG Cafe through First Five of Contra Costa County. And then we'll go ahead and wrap it all up with our representatives from the Regional Center of the East Bay. So without further ado, we will go ahead and go directly into CCHP BHD Behavioral Health Department overview with Dr. Magda Souza.
Hello, good afternoon, everybody. Can everybody hear me okay? So here at the BHD department, we have autism spectrum disorder and behavioral health treatments. So behavioral health treatments, it's in three categories. First one is CDE, which is comprehensive diagnostic evaluation, and FBA, ABA. FBA is the initial assessment, and ABA is the continuation for services for children with behavioral health needs. So to be eligible for BHD services, a medical member must meet all of the following. It can be one or another. It has to be all of them. They have to be under 21 years of age. They have to have a recommendation for a licensed physician or a surgeon or a licensed psychologist that evidence-based BHT services as medically necessary. They have to be medically stable. They have to be without a need for 24 hours medical or nursing monitoring or procedures provided in a hospital or intermediate care facility for person with intellectual disability. So they have to be stable. They can't be inpatient at all. So the way to access BHT services is the PCP sends us a referral for either CDE or FBA. Then we review that referral for medical necessity. If approved, both the referring physician and the family will receive a letter. Then the family needs to schedule an appointment for assessment. And for the CDE, which is comprehensive diagnostic evaluation, so it's a test used to diagnose autism, and it's administered by a licensed psychologist. The referral provider or PCP must indicate which CDE provider they want to use. So in opposition of ABA, FBA, the family can pick up a provider that they want. For the CDE, the PCP needs to send a referral for a specific provider. CDE providers that we have within our network are Aspire, Ability Psychological Services, Serene Health, Dr. Rebecca Dubner, Jigsaw Diagnostics, Autism Center of Northern California, and Dr. Teresa Johnston. So those are examples of people who can do the CDE. For a functional behavioral assessment, which is the first part on the ABA treatment, the ABA treatment starts with the assessment. So ABA, Applied Behavioral Analysis, is a science-based therapy that helps increase positive behavior and reduce harmful ones. While often used for children with autism, it can also be beneficial for those with other developmental delay. So actually, any type of developmental delay can benefit from an FBA and ABA treatment. ABA therapy begins with a functional behavioral health assessment to understand the child needs and strengths. Based on this, a personalized treatment plan is created and adjusted over time as needed. FBA authorizations from CCHP are not assigned to a specific provider. So this is what I just said before. The CDE, the referring provider needs to choose a provider. But for the FBA and ABA, the provider just puts in a referral and they don't need to choose a provider. We have a list and the family receives this list with the authorization and they can pick up a provider. And families normally choose what's geographically doable for them, also according to the services that are offered. Some parents like after school, which is our most demanded time. And some parents like providers who can speak other language. Examples are Spanish. Some parents are reluctant in using interpreter services, so they prefer providers who can speak their language. So the family can choose wherever they want to go. And we also offer neuropsychology testing. PhD processes referral for neuropsychology testing and medical necessity. Initial consultation or intake appointments with neuropsychologists do not require prior authorization. So anybody can refer themselves to a neuropsychology for an intake, for initial consultation. However, once that initial consultation takes place, if the provider thinks the patient will benefit from neuropsychology testing, then they need to submit a referral to us, and then we will review the referral for medical necessity. If approved, then the patient can keep going with that provider that they chose. And how can members access these services? They can call member services, or they can call access line. That's for non-specialty mental health services. And any patient can refer themselves to psychotherapy and psychiatry for medication management or talk therapy. We don't require prior authorization. A while back, we issued one initial and then 6 follow-ups, but now we don't require review for any amount of psychotherapy or psychiatry for medication management. So anybody can refer themselves to any provider that's in network for them. No authorization is needed for any outpatient mental health services. For inpatient, yes, we require prior auth, but for outpatient, we don't require any prior auth. And I am done. Any question?
Thank you, Magda.
Thank you.
So if there are any questions from anybody, we're not going to be doing a verbal live Q&A. Please feel free to go ahead and drop your questions directly into the Q&A box at the bottom of the screen. And our panelists will be able to go ahead and answer those questions for you. So the next presenter we have is going to be Regional Center of the East Bay. We are going to have Christine Hansen, Lindsay Manager, and then Lucy Ravello, who are going to go ahead and talk about the programs housed in the Regional Center and how we can access those, and a little bit about the eligibility.
Hello, good afternoon. So Regional Center of the East Bay serves individuals with developmental disabilities diagnosed prior to age 18. And within the scope of our services, there are different waivers that people are on. And that's what we're going to focus our presentation on today, as well as what services might be available to people in different age groups. So one of the federal waivers is the HCBS Home and Community Services-based waiver. To qualify for this waiver, there needs to be a diagnosis of a developmental disability, have to be an active case with Regional Center and Medi-Cal, You should have a substantial deficit in 2 or more areas of care. So we have an assessment team that's looking at that and determining meeting that level of care. And really, when we're looking at this, we're looking at would this person otherwise be institutionalized without regional center services? The service must be billable. So this is something that regional center has to be able to bill on. 18 years and older. And then there is something called the 1915C waiver, and that includes the enhanced care management portion of this waiver. For children, we have something called institutional deeming, and this helps provide people, children ages 3 to 18 with Medi-Cal. And it's part of a special Medi-Cal eligibility rule that considers only the children's income rather than the family's, so that they can obtain Medi-Cal benefits regardless of parents' income. And to qualify for that, we're looking at the same criteria as the over 18 waiver eligibility. The next waiver is the Self-Determination Program waiver, or SDP. SDP is a alternative method of service delivery through regional center that's very new. It started about 5 years ago, and it gives people some flexibility in using the funding available to them through regional center. So in our traditional model, everything that we pay for has to be implemented by one of the people or companies that we're vendored with. And in SDP, that's not something that has to happen. Self-determination also is a federal waiver that provides that alternative service delivery method that the individuals we serve can access. So you can be in self-determination and not on our waiver, or you can be on our waiver. It does require more accountability on behalf of the individual and family that we serve. And you need to be an active RCEB case, so not a provisional eligible case, and not living in a long-term care facility, such as a skilled nursing facility or an intermediate care facility. Again, you need to have active Medi-Cal, and it could be considered duplicative with that enhanced case management that is offered through the county. Then the last waiver is the HCBA waiver, Home and Community-Based Alternatives waiver. This is also new and provides case management services to people at risk of nursing home placement. It's a multidisciplinary approach, so this is really guided by the managed care plans and not regional center. There is a cap on how many people can participate in it. And the eligibility is very similar to the other waivers. We're looking at substantial limitations, Medi-Cal active regional center, and disability prior to age 18. One thing to note about this waiver is that you can't be on more than one waiver. So you're going to have to make a choice between HCBA or self-determination model waivers, or HCBS waiver, but you wouldn't have multiple waivers. And I'm going to let Chris Hansen take it from there.
Okay. So I am going to talk a little bit about services and supports that are offered by Regional Center. And I'll admit, when I heard the description of what we were going to talk about, I thought, oh, you guys have a lot of focus here. I can see on younger folks and kids, and I'm actually the associate director for adult services, so I have a lot more familiarity with adults than kids, but we'll go over the services to the best of our ability. First and foremost, regional center case managers themselves provide case management and advocacy for the individuals that we serve. So for our children or our transition age youth that are still interfacing with the school district, for example, the case manager can accompany the family with when they go to IEPs and provide advocacy and support for the family in that IEP meeting to make sure that folks are getting the services and the supports that they need. Regional center is considered to be a funder of last resort. So our case managers are going to look at coordinating all the generic services first before we look at regional center funded resources. So they're going to meet with the the individual who's eligible and the circle of support, the team that's around that person, whether that be family or other care providers. They're going to identify what services and supports that individual needs to live sort of their best life in the community. They're going to then find any generic resources that would assist with those goals. So within the younger population, the school is one of the primary generic resources. In adult services, for example, IHSS from their Medi-Cal is another significant generic resource. Then if the individual needs additional services that we can't find generics that will meet those needs, regional center case managers are going to complete purchase of service based upon regional center policies. And these purchase of services are with vendors. You have to be a vendor with the regional center in order for us to write a purchase of service and pay you. And that's how folks get the additional services. And then I believe, yes, this last slide just shows examples of some of the services and some of the supports that we provide. You can see for children between the ages of 3 and 18, respite and daycare is definitely one of the primary services that we provide. Respite being a break for the parents from the care needs of the individual, and daycare being something that we provide for individuals who need support, can't be home by themselves, and the parent works outside the home, and maybe they get home from school at 3 o'clock in the afternoon and somebody needs to be home when they get home and until the parent returns from work. So regional center funds that kind of support. We also do fund behavioral supports. Again, we're going to look to generic resources. I've been at regional center long enough to remember there was a time when we funded more behavioral supports, but now Medi-Cal funds things like ABA a lot more frequently. And so regional center funds behavioral supports after the generics have been exhausted if the individual needs more or more intensive or isn't Medi-Cal eligible for some reason. The big thing recently in the last few years, we did reinstate social recreation funding. So that means that families can be reimbursed, or they can go through what we call an FMS provider, a financial management service provider, to get funding for swimming lessons, horseback riding lessons, time in the gym for, transition age youth that want to maybe go to the gym in their neighborhood and work out, all kinds of social recreational things. I mean, there's really no limit to what we're looking at there. Residential placements, we do fund for children. Although, of course, it's always the last resort. We like to do everything we can to put supports in place in the family home to maintain a child in the family home. Nobody wants to see the placement have to happen, because having kids as part of their family unit is important. So we put services in place to support that if possible. And if not, we do fund residential placements. We do fund durable medical equipment as well. And then you see IEP advocacy and parent training. Parent training is just reimbursing parents for attending a conference or attending a training themselves that they feel is going to assist them with parenting an individual with developmental delays. And then obviously there's many of the other services that are common across age groups. Young adults and adults both use independent living skill instructors. Those are people who go and assist them with learning the things that we all need to learn to live independently. How to pay their bills, how to budget their money, those kinds of things. Again, residential placements you see in all three groups. Supported living is more of a support to live independently in the community and less of a teaching of the independent living skills compared to independent living skills training. Job coaching and paid internships are huge. California is an employment first state. So we do look at ways that we can support the individuals we serve in being employed. In recent years, we've come up with a lot of really exciting new sort of incentive programs to try and shift things so that businesses in the community have incentives to try to have some of our folks working there and see what they can do and that they're capable of doing the job. And many of those people then get hired and earn competitive wages, which is an amazing thing. We do also have day programs, which are a more traditional structured option for sort of Monday through Friday things for individuals to do when they're not in the school system anymore after the age of 22, typically. Public benefits, education, transportation services. Regional Center of the East Bay is also one of a handful of regional centers that will act as representative payee for public benefits for some of the individuals that we serve, if that's a service that they need. So that's just a sample of the services. But that's it for our slides.
All right, thank you very much. So next up, we are going to have Miss Liliana Gonzalez from HMG Cafe, which is Help Me Grow and First Five of Contra Costa County.
Thanks, Paisha. Good afternoon, everyone. I'm Liliana Gonzalez. I'm one of the program officers here at First Five Contra Costa. Typically, folks know us as a funder, community advocate, but we really collaborate closely with some of our contractors. And so there's some really great resources in the community that support a little bit more on the upstream side and are really, I think, helpful resources for families who are really at risk and would benefit from accessing parent education services and supports and really understanding their children's development early on. So I'll mention some of those things today. Just kind of high level, First Five Contra Costa, again, is one of the local, it is the local Children and Families Commission. Some of you may know First Five is really a commission that's established across the state. So every local county has its own commission. Our local Contra Costa office focuses on early childhood education efforts, early intervention, and strengthening family supports. So one of the first and very kind of concrete resources that we have available are our new parent kits. And these parent kits are available really to anyone whose becoming a parent for the first time. And you know, it could be a parent, a caregiver. It doesn't have to be a birth parent. And all you really have to do is go online, complete a form, and request your own kit. But in your roles, maybe you want to bulk order for some of the families that you work with. You can also do that. We'll make sure to put in the link, or in the chat, the link where you can directly make that order. These kits are really great because they have some, you know, basic information that most parents should have. But when you're a new parent, you may not really remember, right, like that phone number you needed, or you may not remember in the moment some of the basic things that you have been taught in the parent class about how to support your child. So in it comes resources and information for the family about baby, some of the first things that you need to know when you're bringing home that baby. There is a parent guide with some key resources across the state that are available to all parents. There's a book, a touch feel book, that's almost like your child's first book. What to do when your child gets sick book. We have one of those in there that's been really helpful, and a lot of the families that we've already shared this with often report this is probably one of their favorite items in the parent kit. And the kits are available in English, Spanish, Chinese, Korean, and Vietnamese. Again, we'll make sure to put in the chat as soon as I'm concluding my presentation, the direct link for you to be able to support the parent or caregiver in ordering their own kit if you'd like. There's no eligibility criteria as long as you're a new parent or having a child. You can order one. Okay. Next are our first 5 centers. This is most commonly what folks know about First Five. We fund 5 different centers across the county. These are our local family and resource centers that provide supports for families with children 0 to 5. Very concrete supports around, you know, like group classes, developmental play groups, school readiness activities. We have parent education classes, weekly classes, and other parent support groups, including support groups around mental health for moms, and then specifically for male or father caregivers. At the local centers, we also have community resource specialists that offer one-on-one assistance in connecting families to other community services. So our wheelhouse internally really is that 0 to 5 population and their needs around child development and concrete resources. So we also offer diapers, car seats. We have food pantries on site that families can access for free. And most recently, in some of our East County centers, we're also offering hygiene products and laundry service cards, so that if folks need financial assistance to do laundry, they can get a little card, you know, a prepaid card that they can use in some of the local laundromats. For families to access the centers, all they really have to have is a child under the age of 5. Again, we really are trying to build these really unique community niches that are available for families where they can learn from other families, build network of support. Often in a lot of, you know, the surveys we've done of families, one of the biggest needs is building a community and network of support for parents, right? If parents don't have a village that they can lean on, that can support them, they often are isolated, they're uninformed about the resources in the community. And we have found the First Five centers really offer that for families. So not just the concrete supports, but it really builds a network of peer support that they have. Families can come into any center, they can enroll for supports on site or virtually. We can remotely, we can offer them a link to our application online. Once they kind of enroll, it's really not an application, it's more like an enrollment process. Then they really have access to all of these services, again, at no cost to the family and no other eligibility criteria other than having a child under the age of 5. One of our most popular services at the First Five Center, where a lot of our health service providers refer to often, are our developmental playgroups. And these are specific playgroups available for children under the age of 5 who might be having a developmental delay, or who completed a developmental screen and it looks like they're falling behind. But don't necessarily have the eligibility criteria for services like the regional center. So these are your children with more mild to moderate needs who just need sometimes exposure to a social environment, to some more structured supports, where the parent might benefit from support and understanding their child's needs and development and milestones, developmental milestones. And so these are really great playgroups where the parent gets some hands-on support and educational material, but also the ability of like hands-on practicing with their child in a structured environment with a child development specialist. Another program and initiative of First Five that I work directly with is our Help Me Grow program. Very tangibly, the concrete support we offer through Help Me Grow is our Help Me Grow 211 phone line. So we partner with a local Contra Costa Crisis Center who runs our local 211 and other hotlines to provide a dedicated phone line within their center for care coordination for families who have children under the age of 5 and might have concerns about their child's development, who maybe are just trying to understand, is my child on track? Or who maybe just want a little bit of peace of mind, right? Like, is this typical? What do I need to do? Or are there other resources locally that I can connect to support my child's development? The phone line is accessible 24/7. We have 2 dedicated full-time care coordinators available to support, and we have the language access line available to our care coordinators. And so we've been able to successfully today really support a really diverse group of families with different, language needs. And you really can refer kind of broad. Often we get most of our referrals from physicians who have completed a developmental screener, and after completing the screener, they realize this child's kind of falling behind. There might be a developmental delay based on the screening, but they don't necessarily need to be referred to like a regional center or to a dual school district, but they could benefit from other supports. And so they'll refer them to us. So that's a great referral to send over. Then our care coordinators can talk to the family a little bit about what that screen means. Why did your doctor refer you? Tell us a little bit about what you're observing with your child. And they really build sort of a report first with the family to get a sense of like where they're feeling the most concern, and start by that kind of curating a list of the resources that might be helpful for them and help them in connecting them to those supports. Sometimes in that process, right, we find that there are other concrete needs that they need, like basic resources. Maybe it's financial aid support, legal aid, or they're having housing challenges. And then because again, we are sort of powered by the 211 database, we're able to quickly identify other resources in the community that the families can connect to. And we provide care coordination for as long as the family allows us to be engaging with them. So a lot of times the family will initially connect with us and realize like, yeah, I really would like some one-on-one support around some of these resources. We've followed families anywhere from 6 months to up to a year. We've had families who we serve for a couple of months and then we hear back from them the next year, or now they've had a new child in their family and they come back to us to get support. Anytime anyone refers a family to us, we really encourage you that you notify the family about the referral, that you let them know what to expect, that we will be following up with them, that they'll get a phone call from the crisis center, and that someone can support them with those resources or additional resources. And then on our end, we'll make sure to confirm the referral, the receiving the referral, and we'll let you know as the referring party, what has been happening with this particular family. Just give you some case summary notes every 3 to 4 weeks, or as new activity kind of emerges. To refer to Help Me Grow, you can literally just call 211, let us know about the family that you're working with, give us some basic information, and we'll make a call. You can also go to our helpmegrowcoco.org website, complete the referral form and online, and then we'll follow up with the family. We also have a paper form that you can complete. A lot of folks prefer to do the online referral, right? It's a little bit easier, but you can also do that if that was something that you needed access to, and we can make that available at another time or via email. As I mentioned, one of the really unique things about our care coordination line for the 0 to 5 population is that we are collaborating with the Contra Costa Crisis Center. And so we have access and utilize this the 211 database. And within the 211 database, we've really made sure to curate the resources for the 0 to 5 population so that our care coordinators can use very specific taxonomy and ensure that we have, the appropriate resources available for the families. We also are really excited to collaborate with 211 because they have dedicated staff that are actually monitoring and routinely updating this database, making sure we have the latest information about eligibility, about, what kinds of services are available. If services have changed, particularly during the pandemic, right? A lot of services changed, including eligibility. So we made sure that all of that was quickly updated and post shelter in place as new or programs pivoted again, we made sure that that information was up to date. And even when there are wait lists or, other challenges and barriers, our care coordinators do an excellent job in really kind of, finding alternative resources, helping the family make sure that they do enlist in the wait list. And then in the meantime, let's connect you to something else. If the family has been referred to places like the regional center or school district or other specialty services or mental health services, sometimes those might also take some time, right? In just processing the intake, then getting them situated with services. You can also, sometimes we find that families who are in that situation are great referrals to Help Me Grow, because in the process, we can help identify other key resources in the community so that the family's getting some level of support as they're waiting to enroll in these other specialty services. Sometimes families don't realize like the libraries have a lot of really great and unique supports that can help. Some libraries have been offering like speech specific playgroups. They don't happen often, but they might be offered every couple of times in a year. But our care coordinators are actively connecting with the community. So we have the latest information about those services, even those that might be a one-time kind of offering. Just wanted to highlight kind of high level. I know Patient introduced our Help Me Grow cafes. In addition to really supporting the families directly as providers for yourself, one of the things that we offer is support, technical assistance, particularly for the providers or folks in the service delivery arena who are conducting developmental screening. We provide ASQ trainings. We provide the material for screening. We do a ton of outreach to families to ensure that they are aware of community services. And we have a collaborating and networking events like our Help Me Grow cafes, which are designed for folks who work directly with families and in a capacity. You can come to our quarterly in-person events and network with other community resources. We really take pride in supporting and funding the local 211 database, but we also know that there's a lot of value in building those direct relationships a lot of times with those direct service delivery providers. So we have these networking events that again take place quarterly that you can access and then again learn about other resources that are happening in the community. And I just wanted to do a quick shout out to some of the broader network of the services available in our county landscape, particularly for the 0 to 5. There's a lot of community organizations that we collaborate closely and that we often refer to through 211, just to give you a sense of what's available for families, particularly for early childhood mental health services. There's the Early Childhood Mental Health Program, our enrichment, We Care services in Concord, in the Concord area. And then we have Vistability's Lynn Center located out in East County. And these are sort of the top three, like the three main known early childhood mental health county providers that we collaborate with closely, do a lot of advocacy with them as well. But they have some really great services, and a lot of times, again, some specialty services that come, only a couple of times a year or only as pilot programs that, we have that information. So through the Help Me Grow phone line, we're able to connect families directly to them and quickly. We also know that a lot of times, especially when there are developmental concerns for children, parents really benefit from additional supports themselves. So we work closely with folks like the Care Parent Network, which is a peer-to-peer parent-run organization program that provides support for families, especially when they're going through that diagnosis process and their journey, or have received a new diagnosis and are sort of just kind of grappling with what that means and trying to understand how to navigate the services. A lot of times too, another main need of families is accessing childcare, subsidized childcare or preschool services. And Cocoa Kids is the local R&R that connects families to resources like that and helps apply for subsidized childcare. So we work closely with them, and we often refer there a lot. There's also the Bay Area Crisis Nursery, which is more of a respite care provider, really great resource located in Central County. And I met with their director not that long ago, and they absolutely have space, right? They have sort of a wait list, the way they function, right? And as like they prioritize the need and the level of crisis of the family is how they kind of decide placement, but they have day respite care, they have overnight. I know they work also closely with the regional center to make sure as families come in for the first time, they're aware of the kind of developmental support resources out there. And of course, there's the Child Abuse Prevention Council that offers parent education supports. They offer some concrete resources like food boxes and some stipends to help families who are financially struggling. So there's again, a plethora of resources available out there. There's a lot, and it's hard to sometimes understand what they all offer and kind of navigate them, but just kind of really to give you a sense of what is out there and the kinds of partners that we have close relationships with and are able to facilitate direct referrals through our Help Me Grow phone line. So again, just a couple of these, and then of course, developmental supports and early intervention supports like the regional center who's here with us. There are a lot of special ed departments, school districts to navigate as well. What's great about, again, our Help Me Grow phone line is that we track all of those different spaces, those different organizations and different departments, so we know exactly who we need to touch base with to help make those referrals, especially as children age out of their start early our early start services, and of course our County Office of Education that provides some support for families within the school districts, but also have their own programming sometimes and offerings directly for the parents. And that's it on my part. Thank you.
Thank you very much. I really appreciate all of the presenters and everybody taking time today to go ahead and spread, as subject matter experts, their wealth of knowledge. I do want to let everybody know that in the slide deck that is going to be posted on our CCHP CalAIM website in the coming weeks, that the new parent kit will be clickable in the PDF. So you'll be able to access that directly from the PDF link. And that also any unanswered questions from our Q&A box will be answered by the teams, and we'll go ahead and send that to everybody that participated in today's educational training. And then also, I just want to go ahead and highlight tomorrow, we're going to be having part 3 in our 9-part series, where we're going to go over whole child, whole family, and just really coordinated care for kids in needs. So we're going to have Contra Costa County Children and Family Services representative, as well as our HIC-PIC-THIC program and California Children's Services. So we hope to go ahead and see everybody here on that meeting tomorrow, and just thank you again for joining us, and everybody have a great rest of your day.